Do you really understand the healthcare system? The Institute of Medicine and the Academy for Educational Development, in partnership with Pinellas County 4-H Youth as Resources, used a proven tool called YouthMapping, or surveying, to assess and address health literacy at a community level.
Now, what do we mean by health literacy? Well, part of it is literacy as we generally think of it, the ability to read and understand information. But what people don't realize, and neither did we until we became deeply involved in this subject, is that over 90 million Americans are what we would call not literate in terms of understanding and acting upon health information.
The interview process is extremely important. Sometimes interviewers or healthcare interviewers will start a client visit by saying, "Are you having any problems?" And to a client, it may not be a problem that they eat lots of fats and lots of sugars on a daily basis. So we need to be very specific about the information that we ask of them. And sometimes we have to actually help them identify that this is a problem. And so the interview process for the healthcare provider is crucial in being able to identify and then to move on to a plan of care or plan of behavior change for the clients.
As part of the coordination for the Health Literacy Mapping Project, I went into local neighborhoods and communities to recruit young people to take part in this project for the summer.
Are you guys the ones who are interested in working this summer?
Yes.
Yeah. Are you guys familiar with health literacy? Have you ever heard of that before?
No.
No. Well, would you guys be interested in a paid job this summer?
Yes.
The young people over 2 days went through a training that prepared them on how to conduct several different types of interviews. Some place-based interviews where they went into places and asked things around who helped them produce their health materials. Some people-to-people where they asked for perceptions and opinions as it related to some of the people agreeing or not agreeing that health literacy is an issue in communities. And they also did some observational mapping. During this training, the young people were taught world of work skills. They were taught how to go in, they were taught how to conduct interviews, how to sound professional, and also what to do with the data that they collected. So we're very excited about the opportunity to present these findings as it relates to health literacy and looking forward to the next steps of health literate work in the community.
Throughout the 6 weeks of the summer program, the young people spent time in the fields collecting data,
address so we can email you,
as well as coming into the office to enter the data into the system and schedule appointments.
Yes, some of the pharmacies I went to, some of the pharmacists seemed surprised that a whole bunch of teens would come into their organization and ask them questions about health literacy, because most teens don't really ask questions about that. I think it was very important to have teens addressing health literacy because it's not only the adults that don't understand it. Some teens have to take their own medicine, but they don't understand what they're supposed to be taking or how they're supposed to be taking it.
Before this experience, I had trouble approaching people and talking to people on the phone that I didn't know, but because of it, I'm not afraid anymore. Yeah, I think this job is going to help me more in my future. It taught me more about communication and how to communicate with other people more.
By the end of the summer, the young people had developed workforce skills as well as communication and their ability to talk out in the community with folks. So for me personally, it was just an amazing experience to watch these young people grow all summer.
At the end of the summer, the youth had the opportunity to share their initial findings during a community presentation. The data will be used to implement change within the community to improve health literacy.
It's a good organization. It helps young kids like us control our health instead of having bad health, so I think that was good.
The program was extremely successful in collecting useful data, but the experience gained by the youth mappers will last a lifetime.
I didn't know what health literacy meant until I met the 4-H Youth as Resources people, but now that I'm 17 years old, I'm a high school student, 12th grade, I know what that stuff means, so I won't have trouble later on in life doing it. So that's what I learned.
If somebody said that they might end up doing the same thing I did for the summer, the 4-H Youth as Resources, I would tell them to go ahead and do it because it's a real fun experience to do and it's very educational.